I want to talk to you about vision therapy, which is a unique attribute of Eye Center Optometrics that has been around it's a service that we've been providing since the mid to late 1960s, so quite a while, over 50 years. Vision therapy is, when we talk about vision, we typically think in terms of 20/20, 20/25, and that 20 stands for 20 feet, and so that's distance vision, and that's critically important that we have people seeing as optimally as they possibly can. But when you read and work up close or on your cell phone or on a computer, there are a number of things that happen physiologically within the eyes. First thing that happens is that we look at the ability for the eye to focus and for the eyes to go from their resting point to converging inward to whatever the plane is that they're using to read at. And then we look at tracking. And so those are what we call visual efficiency or muscle coordination skills. So the first thing that we look at is optical performance. Can you get 20/20, and how does your distance vision, as well as looking at the ocular health? Is there any issue with the retina, with the lens in terms of a cataract, with cornea for any scarring, any dry eye issues? And those are important, but the functionality up close. In today's school, more than 75% of the day of a child's day is spent doing close work and near work. And so your focusing system is part of the autonomic or automatic nervous system that is akin to heart rate and breathing and so on. It's just something that is part of our autonomic nervous system and just does automatically. The closer you bring something, the more the focusing muscles have got to tighten up. And so roughly at reading distance, about 3 units of focusing. And then in terms of up close with the eye alignment, your eyes have got to turn in about 15 degrees. That should be an easy, effortless task. I had a patient in this morning that couldn't read for more than about 10 to 15 minutes before he started to experience eye strain and blurring of vision and such, where the focusing system is just giving out. So in terms of vision therapy, the first major area is the whole area of visual efficiency and muscle coordination. How well do we work in terms of your ability to focus? How easy is it? You've got a finite amount of attention that you can devote to the task. And so if you're wide awake and feeling good, maybe it's this much. If you're a little tired or emotionally upset, maybe that focus or that mental energy or concentration level is less. But whatever that amount is, your visual concentration and your ability to focus, to track, to maintain binocular vision there is something that should be very, very simple and require a minimal amount of subconscious energy, so that the majority of your attention and concentration is working on the area of decoding and comprehension for what you're reading. And we will get patient after patient that says, I can only read for 20 minutes, 30 minutes, 40 minutes, and then I start to find I have to really concentrate more, I have to put more effort into it, because the focusing skills, because they're weakening, then begins to create a situation where they're having to expend more energy on what should be easy and automatic. From there, once you get that input in an orderly, clear, concise fashion in terms of focusing, eye alignment, tracking, and so then we want to look at visual perception and visual perceptual skills. How well do you handle that? And so these are things in day-to-day living, being able to look at something and see it in your mind's eye, or to copy something off the board or from a paper. And so visualization and visual memory and visual closure, there are numerous visual sub-skills that are crucial to performance. And so we measure those things, and those are vastly different than how well can you see in terms of 20/20. And not that 20/20 isn't important, it obviously is, but these are skills that about 18 to 20% of children have difficulties with, that impair their ability to read and to learn. Here at Eye Center, to quickly be able to tease out the element of those patients that are having those problems, we use the vision therapy questionnaire, and on that, a score of 15 or less is considered normal. 16 to 20 is there may be a visual performance issue that is interfering with reading and learning, and above 20, there's a high statistical validity that vision is interfering with a child's ability or a person's ability to be able to read efficiently and effectively. We have treatment for that that takes now anywhere from 6 weeks to 6 months. We have the patients working a half an hour a day at home and come into the office every 2 weeks, and that works out amazingly well. We get tremendous success today. Again, I had another patient who was a non-reader, and about 2/3 of the way through vision therapy, she started to be able to read and take off. Her mom, she came in today, it's the 6-month post vision therapy check. Mom says, I never ever thought I would say this, but I have a hard time keeping her in books. She's going through books. I have to come in at night and tell her, put the book down and go to bed. She says, not in my wildest dreams would I believe that that could have been the case. And so the impact that we can have on children's lives and on adults' lives with and through vision therapy is absolutely amazing, and it's a wonderful thing to be able to do, and it's a wonderful thing and a wonderful aspect of Eye Center Optometrics.